The biggest challenge, I believe, facing us in the world of haemophilia treatment is to produce vectors, that's modified viruses or other methods, that will enable us to cure the hereditary forms of haemophilia A and B and the rarer forms, 7 deficiency and factor 10 deficiency. Right now, we have to give treatments repeatedly. If with factor 8, 2-3 times a week, with factor 9, slightly less often. We now have extended half-life products that reduce the frequency of treatment down to weekly or even fortnightly. But it still involves a very expensive and laborious and ever-repeated process that only temporarily corrects the bleeding tendency. The half-life in blood of the clotting proteins is not very short, but it's certainly not very long either. So we would like to be able to get away from intravenous infusion. Ideally, we'd like to get to a single-dose treatment with gene therapy. We're part of the way there now. We have been able to convert some patients from severe haemophilia to mild, moderate, or even more recently, the normal level. How long this will last remains to be seen. We have data in our own study up to 10 years now, but we'd like to attain a lifetime conversion from severe bleeding tendency to no tendency, to normal. That's one challenge. Taking this to the rest of the world, where most patients with haemophilia still have little or even no treatment and a short and painful life due to the outcome of bleeding into joints or into other areas, the brain, which of course can be fatal. So that's a challenge, to get that treatment available where it's mostly needed. We're still short of really good, effective and safe treatments in the area of thrombosis. We can help patients who've got a thrombotic tendency, such as, for example, with hereditary lack of the anticoagulant factors, which also circulate in blood, to stop us from overcoagulating. And we can now give oral treatment for that. But as time passes, we do see a downside to that, which is in especially older patients on anticoagulants, there is a higher risk of bleeding, which can be very troublesome, even fatal. So we need better approaches in the anticoagulant area too.